Hello, I'm Dr. Inman. You probably know me. I've done a number of videos. There's over 400 of these videos that are out there. You should check out the YouTube videos from me, and you'll see that they're covering lots and lots of different categories and how we address that. I'm a retired veterinarian and a mammalian researcher, and so my job is to help people that have problems with dog, cat, horse, and human, essentially. And I provide that type of care through a number of different technologies. This is a short video on prostatic hyperplasia, very common. It occurs in the dog and the human being, of course, very commonly. The etiology of prostatitis essentially is interesting because as the mammal gets older, essentially, the dog and the human being essentially ends up with testosterone in the system producing a lack of blood supply and venous drainage and lymphatic drainage from the inguinal area, which basically then causes the accumulation of the byproducts of metabolism and toxic events that basically break down the tissue and irritate the tissue. The body's response, including the prostate, is in fact, when it's robbed of blood supply and venous drainage and lymphatic drainage, is to hypertrophy. And as it hypertrophies, it's like a donut. It gets swells up, and compresses the area around the urethra, compromising stream of urine. And also it presses up against the side of the pelvic nerve, which compromises the ability to voluntarily urinate, and that continual irritation on the pelvic nerve causes the effect where the person or the animal has to continually urinate, or at least feels like it needs to urinate. It also can produce some problems such as erectile dysfunction and also other intimacy problems essentially associated with pressure on the pelvic nerve. Of course, our goal is to reduce the swelling of this benign prostatic hyperplasia. Benign prostatic hyperplasia will occur and occurs in about 40% of all men over 40, 50% of all men over 50, 60% of all men over 60, and so on and so forth. So the chances that somebody over 40 has a benign prostatic hyperplasia is really high, and it gets higher as the person gets older and older, essentially. We're able to effectively treat that with a number of different prostatic frequencies using the new laser. The laser basically has its ability to direct functions to increase the blood supply and lymphatic drainage, but also treat the condition that's occurring. In the canine, we'll have a tendency in the old dog to neuter them, take away the testosterone, give them anti-testosteronic medications, female sex hormones, essentially, and antibiotics if they have an infection. That's not really something that we do in a human being, nor do we have to, because we can easily use anti-testosteronic frequencies and optimize the function of the pelvic nerve and decrease the swelling with the use of this prostate settings with this instrument. And it isn't any more complicated than doing this. Big deal. Okay, do this for 60 seconds essentially, and do it twice a day for 3 days, once a day for 3 days, and twice a week for 2 weeks, and the problem should be well under control. It could come back 8 or 9 months or a couple years later, and then you laser it a couple more times and it goes away. Very commonly, the client will actually see a benefit within 12 hours easily that evening. And so this is something that we like to treat, because the body responds real quickly to these protocols. We have, if there's continual irritation in the benign prostatic tissue, essentially, it can develop a tumor, and there is a frequency for that basically helps the body deal with that, essentially. And also there can be a malignancy, which is not very common, but nonetheless there can be a malignant cancer essentially that's involved with there. But as these are just different stages of this condition, basically what happens is benign irritation causing benign prostatic hyperplasia that can sometimes produce a tumor, that can sometimes be a nasty tumor. And so we want to make sure that we decrease the benign prostatic hyperplasia as much as possible, so that the client basically, or the patient, doesn't have polyuria, in other words, have to urinate a lot. This continual urge to urinate, which drives people crazy essentially, can't get very far away from the bathroom, intimacy problems and lack of erectile ability and sexual dysfunction essentially, and the possibility of retention of urine, which basically can cause a cystitis, and a benign prostatic hyperplasia condition also can produce prostatitis. We can treat all of those conditions. There's about 8 different prostate protocols with this instrument, and we endeavor to use it essentially effectively. Very few things that we treat work as fast and as effective as treating for benign prostatic hyperplasia and prostate problems using this instrument. And again, we just turn it on, we dial up, in this case, prostatic hyperplasia, prostate problems general is another one that we can use. Essentially, hit the button, we're lasering at about 280 or about 20%. and we're directing it into that area. Clothing doesn't have to come off. There's no shaving, etc., etc. We can actually come from back too if we have to, because this instrument will go all the way through the body if it's the correct one. Keep in mind that this is the instrument that that we're using as a tool, and it's programmed with 1,800 different protocols, of which 8 of which are prostate-directed protocols, essentially. And you can get that only through me. This laser is available through other sources, however, not with the protocols, and other sources of this laser cannot be upgraded to my protocols, so you have to get it from me. And quite frankly, you pay an extra $800 for those protocols. There's only one reason to have this laser, is to have it lit with those protocols, and so this is a tool that delivers the protocols, and that's what's important. By the way, that $800 is what's sending my daughters to college, so there you go. We've basically accumulated these protocols for the last 20 years, and we're real proud of them. The success with this instrument is remarkable. You can reach me if you have any questions about this treatment. Area code 208-640-3430. That's 208-640-3430. Or you can email me at drbill@vomtech, that's VOMTECH.com, and I can get back to you and give you some help with that. As I mentioned to you, I'm retired, and my job now is to help people who have problems, essentially, and so that's kind of what I do. So thank you for listening to this YouTube video. I appreciate your patience, and have a great day.